Okay, so this is a 68-year-old female that was admitted with post-surgical complications. She's currently recovering from a sternectomy that was performed 2 days ago due to an infected cabbage site. She's alert, oriented, and hemodynamically stable, but she does have a large sternal wound, like right in this area. And it requires ongoing monitoring and care. She is on a cardiac diet, has no known allergies, and is a full code. She has a significant cardiac history, including pulmonary artery disease and a prior myocardial infarction. And that's why she had to get the cabbage 2 weeks ago. And that's the one that became infected. And that's what led to the sternectomy. She also has a history of diabetes. So for her post-surgical care, she's been receiving lactated ringers at 75 mLs per hour through a right AC 20 gauge IV, and she also has a left hand 20 gauge IV in place, saline lock. For pain management, she is on morphine, 2 milligrams for scheduled pain control, but it's followed by Toradol an hour later for breakthrough pain. She's able to ambulate with assistance, and she's been tolerating this pretty well so far. Her sternal wound is clean and dry, and she has no signs of infection. We dressed it earlier in this shift and reinforced the importance of keeping the site protected. She's been compliant with her cardiac diet, and her blood glucose levels have been within range for her. Her pain has been pretty well controlled with the morphine and the Toradol. She had whenever she has breakthrough pain, you kind of you give the medication Toradol an hour later. Vital signs are stable. Her most recent blood pressure was a 124/78. Heart rate was 88. Respiratory rate was 18, and oxygen saturation was at 96% on room air. Her capillary refill and peripheral pulses are within normal limits. Oh, the IVs are patent with no redness or swelling noted, and she's tolerating the LR pretty well. My recommendations, continue the current pain management schedule. Monitor her pain levels closely. That way, she can be comfortable healing. Keep monitoring her sternal wound for signs of infection or complications, because we want to keep that area clean. And sure, she continues ambulating to prevent complications like a DVT or any pulmonary issues. Make sure you keep an eye on her blood glucose levels before meals, Monitor her IV sites for any signs of phlebitis since she has the 2 lines in place. What else? I think that's it. Let me know if you have any other questions.